So here, these two types of the tumors are there. These two types of the tumors are especially is the benign tumors and also malignant tumors. So benign tumors is not a cancerous tumors, but also it gives the complications if it is not controlled properly. It's not getting the proper treatment for the benign tumors. So if you see the benign tumor and malignant tumor, the differences, so at least we can understand what is the dangerous tumors and also what is the non-dangerous tumors. So if you see a benign tumor is not a malignant tumor, so which is the cancer, so it is also cancer, it does not invade nearby the tissue or spread to the other parts of the body the way the cancer. So that means it's also, it gives the abnormal cell growth, but it's not going to spread to the other parts of the body. For example, if anybody having tumor or a benign tumor in the chest region or maybe in the axilla. So because of this one is going to increasing the size of the tumor, but it's not going to spread to the other parts of the body, such as, for example, from the axilla to the chest, from the chest to the maybe neck, or maybe neck to the other shoulder. It's not going to spread. Only at particular part, for example, if the axilla, the tumor is there, is going to increasing the size of the tumor. So because of the increasing the size, it may use the space occupying to the other structures. So it may compress the surrounding structures, but it's not going to spread to the other parts of the body. So that is the main difference between the benign tumor and also malignant tumor. So in most cases, the outlook with the benign tumors is very good. It looks like we can see the shape and also size. But benign tumor can be serious if they press on vital structures such as the blood vessels and nerves. So just now we discussed, so it's not going to spread to the other parts of the body. It's going to spread or is going to compress the other surrounding structures such as the blood vessels or nerves or maybe any organs. So if it is compressed to the important structures, so it may use the complications. For example, if it's compressed to the artery, so it's going to decrease the blood circulation to the surrounding structures. Or if it's compressed to the nerve, it's going to give the decreasing the function of the nerve functions. It leads to the paralysis. So these are the complications of the benign tumors, but it won't spread to the other parts of the body. Coming to the malignant tumors, so these tumors are the cells that grow as uncontrollably and spread locally and distant sites. So for example, if anybody having a tumor or malignant tumors in the axilla, so it's spread to the breast, and it's also spread to the lungs, and may affect to the spread to the neck regions, and also spread to the back. So all the parts are sometimes from these cells are going to be transmit to the brain. So this all the parts are also going to be affected because of the transmission of these cells through the blood as well as the lymphatic system. So these malignant tumors are cancerous, so which they invade other sites. So it's going to be affect to the other parts of the body. They spread to the distant sites by the bloodstream and lymphatic system. So this spread is called as the metastasis. So metastasis means the spread of the infections or the abnormal cell growth is spread from one place to another place, even though it's the distant sites. For example, if anybody get the damage or if anybody get the malignant tumors in the ankle region, so it may spread to until the brain. So this may spread to the blood and also lymphatic system. So that is the reason this tumor is called as malignant tumors. So you can see the difference between the benign tumors and also malignant tumors. So if you understand this image, we can easily understand about the difference between the malignant and also benign tumor. So for example, the benign tumors, so benign tumors are going to be, for example, this is the benign tumor. So here it's not going to spread to the other parts, it's going to compress, it's going to press the other parts. So it's going to space occupying, it occupying the other parts of the structure, other parts place. If, for example, this having the lung is affected, for example, any tumor in the lung. So if it is growing, if it grows, what happened because of the expansion of this tumor is going to compress the surrounding structure of the heart, or maybe surrounding to the downwards, maybe it's affect to the like a stomach, or maybe if any stomach in the tumor in the liver. Because of this expansion, it may affect to the other parts of the organs, such as maybe pancreas or maybe spleen or kidney. So because of the space is going to be occupying, space is going to be increased. Because of the space increasing, it may use the compression to the surrounding structures. So because of the compressions, so it gives the complications. Other than it won't give any complications. So for example, in case of the papilloma, that also one type of the tumor, but it's not going to give the much compression. Maybe it affect on the skin. So it may leave the little complications. And also it won't give you any other complications. Simply be called as papilloma means if anybody having the warts, skin warts, maybe in the skin warts, we cannot, it won't get any symptoms. So, but, so for example, this is also like a one type of the, okay, this is also something like a wart. So most of the people are going to get this type of the warts, also called as like a, some skin warts are also called papilloma. Medically we call it the papilloma because of the virus effects may chance to get the small enlargement of the like extra tissue growth on the so many on the skin as well as so many places in the eye, in the mouth, on the breast. So many places also going to get. So this is type of a tumor, but it won't give the complications, and also it won't give much. Okay, you can see here. So this also affect on the knuckles or maybe on the skin anywhere, but it won't give much complications. So in this condition, this type of condition, we won't get any complications. But inside, if anything, structure is going to be compressed like this one, inside any other part of, if the surrounding structure is damaged, so may chance to get the nerve injury or blood vessel injury, any other structural complications may chance to get. So that is the difference between the benign tumors and also malignant tumors. So being the malignant tumors, so it, for example, if the cancer is here, it is going to affect the other parts. It's going to hit the other parts, other structures of the body. So that is difference between the malignant tumors and benign tumors. If you see the changes, the physiological, pathological changes in the benign tumors and malignant tumors. So here you can understand the size is going to increase in the benign tumors. So, but here is going to be spread to the other parts of the body, and also the size and shape of the cell membrane, and also nucleus is also going to be, and also it's not organized properly. If you see the nuclear variation in size and shape is going to be minimal. So here also is alters the nuclear size and shape, but is a minimal. But is going to be the very heavy, is going to be is a high variations in the size and shape of the nucleus. And also is going to divisions also going to be the diploid, and also is the range of the ploid. And also here also going to be the low mitotic count, that is normal. The division is going to be very low, but is going to be is the abnormal mitosis. There is no control of the divisions. And also retention of the specializations, and also here is going to be loss of the specializations. So the cells are going to be not responding. And also is a differentiation, structural differentiations, and also is showing the structural differentiation shows the wide range of changes. It's organized, and also this malignant is not organized. And functional is a differentiation usually, and also is all the functional differentiation is going to all the loss. So all the functions are going to be, normal functions are going to be lost. So that is the difference between the benign tumors as well as the malignant tumors. So that is the reasons malignant tumors are going to be very dangerous than the benign tumors. If we control the benign tumors, if we remove the causative factor for the benign tumors, so then we can control the symptoms. But malignant tumor, if we remove the tumor, still may chance to get the cells, if the divisions takes place, again may chance to get after removal of the tumors also may chance to get, after the recovery also may chance to get.